Hey there, remember these? You probably haven't been down the pad aisle recently, but there are many solutions for postpartum bleeding, and it can be kind of confusing. Just the topic of bleeding postpartum is not, let's just face it, it's not the most exciting topic, but it is really important, and I want you to be prepared and know what resources you have, what are warning signs to look for, and kind of what to expect from postpartum bleeding. So we're going to handle all of that today. I want to make sure you know that if you ever, in your postpartum time period, after you give birth, if you ever have any concerns about the amount of bleeding, the type of bleeding, you should definitely call your care provider. So this actually starts after you give birth. When you are at the hospital, overnight at the hospital, if you're having bleeding that is concerning you, you have questions about it, don't hesitate to hit that nurse's call light and get them to check. You're usually the first one to be able to spot a problem. You can feel gushes, you can see clots. Those are things that your nurse needs to be aware of, and you helping them be aware if you see something is so important. So don't feel like you're bothering them, even if it's 3 a.m., definitely call out. Now, once you get home, you can also experience some concerning postpartum bleeding, or you might be concerned and not sure if it's too much, if it's something that your doctor should check out. So don't hesitate to give a call to your care provider, your OB office, or your midwife, and let them know that you have some concerns. And they probably will ask you more questions about what you're seeing, and you'll be able to give them some more information. But I don't want you to wait about this because it's something that can change really quickly. A postpartum hemorrhage is possible from any time after birth through the first 12 weeks after you give birth. Now, it's more common in the first 24 hours, but it can happen in that time after birth. So being aware of what's going on with your body and being in touch with your care provider is always important, but it's super important when it comes to postpartum hemorrhage. Okay. So we got the most important part out of the way. Let's talk about the second most important part, which is how are we going to handle this postpartum bleeding? A few things happen. First of all, in the hospital, they usually have a solution for you. You usually don't have to bring your own pads or adult diapers. We'll talk about all of those options, but they usually have something for you. And if it is something that is uncomfortable and you feel like it is huge, yes, it will be. It's usually a very large pad put into mesh underwear that the hospital gives you. So these underwear, you might have heard about them, or if you've given birth before, you probably use them. They are super, super stretchy, which is so great on your body. You don't want anything tight, and you want something to be able to hold the pad in. So generally, they will give you a pad that will literally go from the top of this underwear all the way to the back. So you have full coverage. Not comfortable, but coverage. You can also put an ice pack at the hospital on top of that pad. Often your nurse will do that for you. So that's generally the hospital's option. Most hospitals, especially in North America, do the mesh underwear giant pad routine. So after you get home from the hospital, a lot of people choose to go first into an adult diaper. So there's actually just products changing so rapidly on this as more people are looking to use adult diapers. And this is actually a adult diaper made by Always. It's actually, they call it disposable period underwear. And it is something that you can use like an all-in-one solution and not the mesh underwear and the pad. So let me just show you what it looks like inside. You've got your pad, and then you have everything kind of holding it all together in one solution with kind of a higher waist on these. So I'll show you the box. And this is a pretty new product, not sponsored. This is just something that a lot of my clients like wearing. As their first solution, the adult diaper. So adult diaper is a good sort of next step. The other thing with both this solution and the mesh underwear pad solution is you can put an ice pack on there or a padsicle on there, so that if you make a padsicle, you can put that right on top of these adult diapers or disposable period underwear, whatever we want to call them, as well. And if you want to see how to make a pad sickle, I'm going to link it down below. I have a step-by-step process, and I'll link up here as well. So you can do mesh underwear that you get from the hospital and put a pad in it, or there's another solution out there that I just found, and I was so excited about them. This is Moon Mama, and it is cute mesh underwear. This is the smaller size. This is the larger size. How cute are these? These are actually washable for many wears through the time that you'll need them. I'm going to put a link down below. I have a coupon because I'm an affiliate and I love them so much. So with the mesh underwear, I generally recommend a larger size pad as your first step. So if you first you can either go to the disposable underwear first and then to this, or straight to this combination. This is just a large size, the heaviest bleeding pad that you would want to go for the heaviest amount in the beginning. And these just sit, and here I'll show you with a regular pad right in your underwear. Oops. So these just sit right there, just like any regular underwear. If they have wings, you can just flap them down. You don't have to get them with wings. It's hard not to find them with wings. Those are a little bit harder. Make sure you have some that's the heavy bleeding, and then have a step down pad as well as the bleeding goes down. Definitely want to avoid is tampons. Tampons are not safe to be used during postpartum bleeding. So your doctor will say this, you'll hear this again from your postpartum nurse, but you definitely don't want to use tampons. Pads are going to be what you're going to use to manage that bleeding, or the disposable underwear. So we've talked about how to manage the bleeding. You're probably wondering, how long is this bleeding going to go on? And the average for most women is between 4 weeks and 6 weeks or so for that bleeding to really taper off and essentially just go away. Now, some people have a time where they have some lingering spotting, but generally that does not last too much past the 6-week mark. And what happens with the bleeding is we see a transition as our body is healing from very heavy period type bleeding down to a lighter period type bleeding, down to some maybe just a pinkish brownish type discharge bleeding as it starts going away. Now, the interesting thing is that our body gives us signs on whether we are doing a good job resting, that our bleeding actually, if we are resting well and we're taking care of ourselves and we are giving ourselves a chance to heal, we will see the bleeding start going on that process from the heavy period all the way to nothing at all. And if you see that you're trending in that direction, you see that they're making progress towards that, that's a great sign that you're healing well. If you don't see any change in your bleeding, if it just seems heavy and continues, then you probably aren't resting enough, or you need to contact your care provider and let them know, especially if you ever have any concerns, like I mentioned in the beginning of the video. But resting can generally help with that. And a lot of times what I've seen with my doula clients, actually, I remember the story so well. I had a client contact me and she said she wanted to ask me a question about her bleeding, that her bleeding had been going down. And then today, when she called me, that it had actually spiked back up and was more like a heavy period again. And she wondered if she should call her care provider, or she just wanted to ask me because I was her doula. And I said, well, tell me about what you've been doing. Did you have anything, different yesterday in what you did postpartum, or it was basically a normal day? And she said, well, yesterday was a pretty big day. I took my toddler and the new baby to the zoo for a few hours, and we walked around the zoo. And she was only in her first week after giving birth with the baby. So her body was really in need of rest. And yet she was at the zoo. And I said, well, my guess is that your body is telling you that you need rest, and that bleeding is coming back, letting you know that you need to heal. So unfortunately, we can't really trick our body. Rest is so important. So the other thing is sometimes you'll notice in your bleeding in that heavy time some blood clots, but passing any type of large clots or a lot of clots, I would give a call out to your care provider. Also, if you notice any type of foul smell, like an infection type smell, then definitely give a call out to your care provider then as well. So we've got lots of choices for managing postpartum bleeding. Again, I'm going to put links to all of my favorites down below. And I'll also link right here to the video on making the padsicle. Padsicles are really nice to have in those first few days to help bring down swelling in your perineum and just generally help you feel a little bit better down there. And until next time, see ya. Bye.